Hey, we are now live, Mr. Keith.
Yep.
So thank you all for being here. And we try to squeeze in this frame, and I've been losing some weight. I'm fitting in here a little easier. But anyway, thank you all for being here. And we had a great dive just now, covered a lot of ground. We wanted to talk about photobiomodulation again. So Keith is prevailovercancer.com. And Keith Bishop is here every week to help guide my clientele and answer questions. And then we do a Facebook Live, and we encourage you all to send questions in. Here at the end, we will cover as many of them as we can. So I'm Paul with Hyperbaric Plus, and we have a hyperbaric air chamber. We're a little different than hyperbaric oxygen, but we come from a different direction, but we get to the same place. It's pretty neat how it works. So anyway, I'm going to let Keith, he's got a outline, and I'll let him tell you where you can find it, and we'll just get started. So thank you all for being here.
Okay, yes, thank you for tuning in. And so we have Instagram, Prevail Over Cancer, and Hyperbaric.plus, Facebook, and we also have Josh with us from Botanica. Did you bring some things with you today?
I got out of the house without
the other lights. Didn't bring it. Okay, so
apologize
on that. So, but we're going to be talking about photobiomodulation, and this is about light therapy, and we'll focus more on one wavelength area above others. That's the area that I've actually studied quite a bit about. But God gave us sunlight, and there's actually all kinds of light associated with that, and light waves that impact our body, and now with the science, we've actually learned that there are certain wavelengths, and it has to do with this kind of a wave, that actually can impact our body. And we talked about this previously. I do have a blog post. Matter of fact, so the handout is going to be available on my blog post. Actually, I didn't have time to post it this morning, but I'll put it on there. And my concentration is typically going to be in cancer, which we talked about before, but I do want to talk about in other aspects. And so, matter of fact, a client a couple of days ago, she is in the United Kingdom and France, and she's having problems with tingling from chemotherapy, neuropathy, and just even from the first dose, she started having problems. And so I'm recommending that she actually use this to improve circulation. So some other terms for this are going to be red light therapy and NIR, or near infrared therapy. And so each type of light actually has a different wavelength. And so we're talking about red light, and so near infrared is still a red. There's near and far and red light, so there's actually several different groups of these. But the red light penetrates the skin a little bit, and is more like things that we'll use maybe for skin and dermatology, maybe even hair growth type of things. I've got a list of, matter of fact, many different health issues, and this is not comprehensive. The amount of research is amazing over the past 5 years, and even just this year, 2025, the amount of research and cancer is amazing. So, and circulation. So, a red light is typically going to penetrate the skin just a little bit, and I have written down like 2 to 5 millimeters, which is like less than 1/4 of an inch, into the skin, and then that's going to be like a 600 to 700 nanometers wavelength for red light. Near infrared is going to be more like closer to 700 to 850, and there's a little bit different variances on different resources on this, but that's going to penetrate the skin, a little bit less than 1/2 of an inch into the skin and body. And then there's even deep NIR, near infrared, that will go over 1/2 of an inch. And there's some studies and types of machines will penetrate deeper, but what's important in this is going to be the quality of the light source. And so, and I'm not a physics person. Matter of fact, that was my worst subject in college. And when the professor walks in and it's snowing outside and he's got sandals on, I just freaked out. And I thought, this guy didn't know what he's talking about. Well, he probably did, but maybe didn't have common sense. But anyway, I just had a hard time with that course, and it's totally abstract. So for in the medical field, we didn't have to have the hard numbers. We were more abstract, and I just had a hard time with that. I like to see numbers. But so I do have listed on this handout, and you can get these handouts on our website. Do you all have it on your website? Do you have a, can we hand out? Oh, yeah, we'll pass these out.
I thought they had
pass
already
these out
been
around
around.
the table.
There you go.
And so I have listed, the importance is going to be also the quality of the product. And so a little handheld battery, type device is probably not going to penetrate very far and be a very good quality product. The red light that you can see is actually that. It is red light. It is not the near infrared that you can't see. So a near infrared is invisible to the human eye, and some animals might be able to see it. I've actually done some infrared type things at night, and I've turned on a light and that I can't see, but the animals respond to it. And so some animals can see differently in different wavelengths than what we can. So with that. So quality of the product is very important. I'll go through this list to be more focused, so I won't skip anything. But it's important for actually dermatology, skin type things, from acne to psoriasis, wrinkles, rejuvenation. Oh, let's go back. Why does it work that way? Well, it's an energy. It improves energy, ATP, in the cells. And whatever cell that is, it's going to have better energy. So skin cells, they're going to function better and grow better. Circulation, blood vessels, the lining of a blood vessel are cells. If we can rejuvenate and help those cells to function better, now that blood vessel is softer and it's more flexible, and blood can flow through better. Actually, blood vessels even help pump the blood through the body. We just don't really quite understand that. Matter of fact, there's even little cilia. I call it cilia. They're actually called calyx. That's inside the supply to the body. And so that's going to be the purpose of a phyto, and get these words right, photobiomodulation correct. But it helps with the body for improved circulation. If we have better circulation to the skin, everything's going to be better. And less wrinkles and wounds. And so, matter of fact, I love to watch veterinarian shows, and for years, veterinarians immediately after surgery, they're putting glasses on themselves, the technicians and the animals, and then they're doing a laser treatment on that wound. They've been doing that in animals for a long time. Why not?
I know.
Why not us? Okay, why not us? And so, because it's not officially approved by the FDA for treatments and not enough human studies, and it's going to be hard to get patents for that, so it's going to take time. We will see more and more of that. So, all kinds of skin type things, neurology, and so that's one thing that Paul is doing here, and is some therapies with red light. And what do you call the helmet?
Well, we have to refer to it as a photobiomodulation helmet, not a red light helmet,
No, red light
because
helmet.
it is Class 2 device,
Okay.
FDA approved.
Okay, so that helps out with injuries in the brain, stroke recovery, traumatic injuries, Alzheimer's, depression, anxiety. So many things. Once again, part of the way it works is actually improved circulation, blood supply. If we, matter of fact, Paul had some information about some kidney type things, and so part of what we're doing here is improve circulation, with these pressure sessions. Is that a good term we can use on that?
Yeah, I mean, you're healing the body and there I said the healing word, but you're actually encouraging, supporting at a cellular level.
Right. Mm-hmm.
If you can support your body at a cellular level, then everything else, that's a foundation to build on.
That's right.
So until you get the cellular level right, nothing else is going to change. It's going to be very difficult. Mm-hmm. And so that's really the building block. And then when you add red light therapy to that, and you add different things that we're doing here for different types of injuries, concussion or ADHD, we use neurofeedback. We're starting to see a lot of our clients are using the photobiomodulation helmet instead of neurofeedback, Because again, if you can get the mitochondrial level enhanced, the rest of it kind of comes along on its own. It's not all about stimulating with neurofeedback.
Yeah.
It's about rebuilding the mitochondria.
Yeah, so the mitochondria are the energy organelles in the cells. They make energy. They take the nutrients that we put in our body, so we have to have good nutrients, absorb those nutrients, and then the mitochondria make the energy. If the mitochondria can't make energy, that cell is not going to be optimal, no matter what that cell is.
So Siegfried is always talking about mitochondrial dysfunction, metabolic dysfunction. Well, that's when that goes away at the very cellular, very foundation, everything cascades from there. So he's always looking at the root cause. How do we deal with cancer? Well, let's go back to the very beginning, the very root, and get our mitochondrial function enhanced, and everything else will follow.
Right.
I'm not too
Yeah,
far
well,
off
that's
base with that
exactly,
comment.
Exactly. So once again, but it's circulation. So kidneys can get better with better circulation to those cells.
Well, you and I are going to have a conversation before you leave today,
Okay.
because I got 3 kidney people and I've got all of their labs. So we're going to have that conversation, and I think that's going to be a topic in the near future, because I think you hold a lot of secrets that the medical community is not trained in, the nutritional value and what you can do just by what you're putting in your body to enhance that kidney function. So we're tracking that, again, starting at the cellular level in the chamber. If you can make your body work better and then give it the proper nutrients, the body will regenerate. It will heal.
For example, if you break a bone, that bone can heal. Because that bone is living tissue, and it will heal as long as we do the right things. We may have to splint it to keep it from moving, allow that to hold together to mend, but even that spot now is actually going to be stronger than the rest of the bone. It's not going to break at that same spot. It's going to break at a different, a different location. So so we want to improve that circulation for that. So the mitochondria is key to helping with that.
And again, going back to what Hyperbaric provides in an orthopedic injury, bone strength is 38% greater if you're recovering in a hyperbaric chamber than if you do not use a hyperbaric chamber. Bone strength, 38% stronger.
Wow. That's
And
great.
healing time's about 1/3 the time if you do it repetitive. If you do a daily hyperbaric session, your overall recovery time is about 1/3. So it floors me that I can't get this information out there and get people to utilize it, especially on a scheduled
Right.
type of procedure. Those are the ones that you actually come in twice before your procedure to get the body ready for the trauma,
Okay.
and then come in 8 times following. And I have people leave the hospital and come and get in the chamber before they go home. It's that important, and your recovery time is literally 1/3. I mean, so anyway.
That's great. So once again, improved circulation. So same thing with doing the infrared type therapies is going to improve that circulation, improve the mitochondrial health. So muscular, skeletal, things we kind of just barely mentioned, but osteoarthritis, tendons, muscle, bones, once again, improve circulation. In oncology, cancer area, by the way, and I see all you waving your hand saying hi, and yes, hi. If you have a question, submit that question, and so they can print that off, and we'll address that toward the end of the hour. And so same thing with the people here. If y'all have a question, raise your hand at the table. But anyway, so there's actually a lot of research showing that for people that have inflammation inside the mouth from chemotherapy or radiation, they'll put the red light therapy in their mouth, and it heals that mouth, those sores inside the mouth. So it really does help a lot. So yes, question.
On your wavelength and tissue penetration, you've got the wavelength type, the penetration depth, and the target tissues. How far away do you have to be from the red light, or how close do you have to be from the emitter to get these benefits?
Yes, and so the question was, how far away do you have to be from that light? And so it actually depends on the quality of the product, of the light source. And so, the closer you have it to the tissue, the better it's going to work. because it degrades with distance. And so once again, a less expensive machine, literally, it probably would have to be right on the skin. But then we lose the issue, because then those little, typically nowadays they use LEDs, they're only, go like this. They don't cover a whole area, so we can lose that.
I've got the same type that he's got.
Yeah, so with that, I'm not sure the distance on that, but, what the one that you have.
So I'm going to jump in there. We've dealt with a lot of different red light devices, and depending on what you're targeting, the ones we use have the lenses, LED lenses, and so they're looking at 6 to 8 inches minimum or maximum. You wouldn't get any closer than that,
Okay.
because the energy is so intense. But where you're using a device that you literally wrap around your knee, that's a red light, LED red light therapy, that's made to go against your
right.
skin.
Some of them have
So
been hacked.
every device that's out there is going to give you guidance as to how to use it. For us to try to cover that with a broad brush doesn't work. You did, and I'm looking at I think you skipped over, or maybe we're not there yet, when you're talking about joules.
Yeah, I haven't
and
talked about that yet.
Okay, so when we get into that, that'll make more
Yes.
sense, and that's what you're going to look at on your panel to determine how am I going to use this for what I'm trying to target.
Yes.
You can enhance the efficacy with other nutritional items as well. So curcumin will make your cells more susceptible to the light or more receptive to the light. There's a lot of things that you can do.
Well, methylene blue is
improve
huge.
improve the quality of the session.
Yes, that's right. So and the comment was about phytobiomodulation enhanced by like herbal products. And so many herbal products like curcumin, do enhance the effectiveness of that energy production, and actually can even decrease a little bit of oxidative damage that might happen. So oxidative damage, think of it as kind of like a sunburn. Okay, well, the curcumin helps to actually decrease that part, but then enhance the effectiveness of the other good things, in that. So curcumin and quercetin and berberine and EGCG and resveratrol, are common herbs that have those type of actions.
There's a lot of studies out there coming out right now on the synergistic effect of using methylene blue with red light therapy. So there's there's so many studies going on right now. Can't keep up with it.
Yeah, and another warning is that even some other medications, so we have to be careful. Some drugs, medications may have an interaction, and this therapy might actually create a burn. Okay?
What medication?
It depends on the medication. So actually, tetracyclines would be one. We can't think of any others.
Well, aren't there a lot of diabetic drugs that you're not supposed to be in the sunlight?
Yes, but I'm not sure if it's going to be infrared or not, an issue for that. But yeah, so some medications I've seen, like tetracycline drugs, antibiotics can be a problem.
One time I took an antibiotic and I turned blue in the sun.
Okay.
It was really weird.
Blue
My
in the
hand was
sun.
In the sun, so it could be UV versus.
Yeah, exactly. So there's all kinds of
infrared,
waves, in that.
It was
in
a
that.
really weird sun
Yes,
color.
and so there actually can be some physical reaction. So the certain types of waves can literally hit this drug molecule and cause it to vibrate and burn. Okay, so therefore we have to be cautious and careful about that. So low and slows. Go low dose, slowly increase that to tolerance, especially if you're taking medications and maybe even herbs that we may not even know about. So we got to be kind of careful and watch for that and be careful about that dose, gradually increase that dose. We do use it also for dermatitis, radiation-induced sunburn. It helps speed up the healing, of that. And then neuropathy, for the fingers and toes especially, but may even help out with hair loss and doing more like a helmet-type treatment, for hair. Along that line, hair and scalp. The really very popular actually is what's called androgenic alopecia. That means testosterone-related hair loss that men and women both have, and so typically it's more like a hair loss in this area. So red light actually helps improve circulation, helps those cells to do better, and kind of I don't like the term anti-aging, but it kind of takes us back a little bit, in circulation and effects in the body to where we were younger before that kind of started happening. And then I mentioned earlier about wound healing, circulation, diabetic ulcers, post-surgery recovery, and even erectile dysfunction. Quite a bit of research going on in that to improve circulation in the body, throughout the body. As a matter of fact, actually, erectile dysfunction is one of those signs. If it's actually a circulation issue creating that issue, that's actually a risk factor. It's not a cause of, but it's one of those signs of vascular disease. And as the body is aging, and so if there's a problem down here, there's going to be a problem elsewhere, in the body. So, so we want to do everything we can to improve that circulation. Okay, now the dosage. We're talking about dosage, about the distance, for the machine. And I'm not an expert. I'm not a physicist. And like I have an uncle who was, and so, but there's a distance about the quality, how many watts that machine has, and then how many joules it's going to be delivering. And matter of fact, actually, Paul probably knows more about this. Would you share a little bit more about that?
So whenever you're looking into panels, it's really important to really do a deep dive. There's a couple of people that actually do reviews of all the panels. Like there's a guy in Australia, and he'll order in 20 panels at the first of each year. And the panels that we use actually were #1 in the last 3 years. So my research and his, they came out the same. The amount of joules delivered per centimeter square.
That's a spot on the skin.
A spot on, just like I always bring this up. People don't understand when you go to a football game, every one of those lights that are hanging up above, that's not an aggregate amount of light on the field. Each one of those lights is pointed at a different spot on the field. So when you're standing in front of an infrared panel, each one of those lenses is pointed at a different spot on your body. That's not an aggregate amount of light. That's delivering the amount of joules per centimeter square. And what he does when he does the review on them is he takes the manufacturer's specs and then he does the spec on top of that to see how close what they're printing as their specification and what is actually in the panel. That's kind of a telltale sign. Are you getting a quality panel, or are you just putting red lights in? There's some gyms now that are using red light therapy, and you stand on a vibration plate. Well, the red lights are a red light, but they are the tube light. It's a fluorescent tube.
Fluorescent tube, right.
And they're about 3 inches in diameter, and it's red. But I can find no spec of how many centimeters, how much joules per centimeter square. There's no specification on what it's delivering. So
those these are special LEDs.
Yeah, exactly.
And a lens, kind of like
focus. And different, and a lot of times they'll have different, like the panels we use. I use platinum LED panels, and they have 7 different wavelengths that they're delivering. And so those are 7 different lights in that lens, and sometimes they'll put 3 in one and 4 in the next one. But again, it goes back to how many centimeters square they're delivering these joules. And it's real important. Without that criteria, you don't know what you're dealing with.
Right.
And so anyway, the other one that you're talking about is milliwatts per centimeter square. So that's how strong the panel is. And what's real important about that, when you get into it, now you're standing in front of a device you're hoping to get benefit out of. What if it's spraying radiation? What if you got this EMF signature that's above normal? You don't want to stand in front of the red lights and just be flooding yourself with EMF. So that's the other real important spec, that when somebody builds panels in China, how much is that being engineered to not deliver RF?
Right.
EMF.
EMF, right.
So anyway, a lot of things to dig down into, and we will put some links up. There's a Dr. Schultz that is doing a MedCram. If you're ever out there, look at MedCram. He just came out with another video, and he's been covering lights since 22, and he goes through all the studies and kind of puts them all into a video and shows you how they get there. MedCram is an awesome place to follow to dig down in and get real detailed information. And we'll be posting this. I've got it on my website. We'll post it under this video as well. A lot of information out there. Don't just go buy the cheapest red light panel because that's what you're going to get.
Right.
The
Yes.
cheapest red light
You-
panel.
You will get what you pay
And
for.
time is money. If you're going to stand in front of a red light, stand in front of it a short amount of time you have to get the dosage.
So, yeah, so what is your time frame on, like, when a person comes in? What do you do?
So on our red light helmet, there are default programs that we start at, and I just called it on our photobiomodulation helmet.
I have to
There,
look at that word every
Yeah.
time, make sure I get it right.
there is, we start at what the default is. It may be 6 minutes, depending on what amount of energy you're using. It may be 6 minutes, it may be 10 minutes. But you come in and you review, did I have these issues after my last session? If I
Okay.
did, I'm not going to add a minute.
Okay,
If I didn't have any of these issues, I'm going to add a minute, and we allow, you can go up to 30 minutes. I don't charge anything for my clients that buy packages. I invite them to go back and learn about the photobiomodulation helmet, because where else are they going to see it and be able to experience it? So I don't even charge them to go and utilize it. And I have people talk about how fast their hair starts growing all the time. It's not even the cognitive that they're looking at. It's like, I can't believe my hair's growing. So there's all kinds of benefit. In fact, the last video, they get into color blindness on MedCram, and he's telling you how he's telling you what cones are changing as we age and why we lose different amounts of our color and why we become colorblind. And the photobiomodulation devices that are out there, there's a lot of them, glasses. There's a guy in the UK that for a very affordable price, you can buy the glasses. And our pupil, our eyeball has the highest concentration of mitochondria in our whole body. We have the highest concentration at the back of our eyeball. That is the most mitochondria in our body. And it's to maintain those cones, and it's to maintain our eyesight for years. That's why there's such a cluster of them.
so but along that line, so this mitochondria and circulation is so important for the eyes. All eye conditions are caused by circulation problems. Even glaucoma. The little valves that control the fluids going in and outside the eyeball, you know, are that little valve. Those valves are are cells. And if those cells aren't working right, if they're getting old and they're getting kind of crusty, now they're not going to allow the fluids in and out properly out of the eyeball. So once again, it's circulation. So even in those channels for drainage of fluids to the retina. The retina is actually the brain. That is part of the brain, hooked up directly to the brain, you know, on that. So yeah, so mitochondria is very important. So do you want to show you want to run these back real quick?
Oh, you can get on our website.
Website,
We got some pictures on there of what that's all about. So anyway, we did that last time. I want people to come in here and learn about it.
Okay.
And if you're in another part of the country, anyway, make a trip to Oklahoma and come see us, and we'll show you what this is all about.
Okay. And so the duration, it depends on the quality of the product. And now we talked about eyes. So this is not something that you want to stand in front of one of these red light things with your eyeballs open, okay?
Protective glasses
protective glasses.
or you're looking away. You just don't stare into the light. So
And so yes, so you know, we're talking about the safety things here in just a moment. So, but it's very important to be careful. You know, there are certain types of therapies that are being developed for the eyes, and they are doing certain types of therapies and shining these lights into the retina areas appropriately. So be cautious about that.
I've got a good friend. I'm going to ask a question, Tina. Does Sam get into red light therapy with? Sam's an optometrist, and does he get into red light therapy at all?
He's not doing it at the practice at this time,
Okay.
but I can ask him more.
Well, we're going to have some conversation about it because there's a lot of really neat things coming out in that, and I'd love to get his take on it.
Okay, so I have another thought, you know, guys. So is there any research showing benefits besides, like, if a person's doing red light, and so we're doing red light here, what about the systemic effects?
Man, that's what, you got to watch this MedCram. It's so crazy. He's even taken the 860 nanometer light wave is actually going all the way through the body. It's measurable on the other side of the body. And they're showing pictures of how it refracts, how when that light hits you, it bounces around. And it bounces all through your body. So even though it penetrates the skin here, as it hits different organs in different parts of the body, it's refracted and it eventually gets absorbed.
Right.
But it's like a workout. You're essentially
Yeah.
stimulating those organs or
Yeah.
those cells in your body, and you're it's like doing a physical workout. It's
Okay.
just at a cellular level.
Okay.
So I had three veterans. We have a veteran program here at Hyperbaric for Heroes, is our veteran program. I had 3 veterans that's exactly what they said. I just feel happy. And so the vibration plate gets the lymph going. The red light therapy hitting your skin is changing a lot of things. It's just enhancing mitochondrial function. And to just come out and feel happy, what a neat way to spend 10 minutes.
That's right.
You know?
Right?
So, yes, that's right. Question?
Response, actually.
Response?
My wife uses the red light therapy a lot more than I do. And she has said that her knees have quit hurting. Her skin is way more beautiful than ever. And you still wouldn't believe how old she is if you look her in the eye.
So
And
passionate.
she is just really proud of herself from all the benefits that she's gotten from this red light therapy.
Right.
She just needs to beat you over the head with that
know.
light and get you using
I
it.
use
Yeah, yeah.
Y'all talk brands.
So we have the Neuronic is our photobiomodulation helmet, and the Platinum LED are the panels. And I did a lot of research to land on Platinum LED, and a lot of my clients have been buying them. If you go to my website and click on the link, I get 5% on your purchase, and you save 5% on your purchase.
Okay, good.
So anyway, there's a path there.
Okay, good, yeah. So matter of fact, the systemic effect is just something newer that we're learning about, and I did read an article this morning about how, how kidneys were actually being impacted, because according to theory, that red light is not going that far.
Yeah, I have a belt, and I thought it wasn't deep enough. I
Right.
think it's a platinum.
Well, but then there's more of maybe a systemic whole body effect, okay?
That goes through.
It goes through, but once again, somebody else is measuring. Now we have technology where we're able to measure some of these things better, versus, okay, this is what's impacting the skin, and therefore in this study in the laboratory, they did this and they find it penetrated this deep. Well, now we're learning the body has some other things. For example, and I'm just trying to think of the physical things going on in the body. Minerals, there's actually studies about these therapies and minerals working together. Minerals, are going to be activated, work better, and even reflect some of those like a mirror and help it to kind of go through the body to a certain extent. Light travels basically straight, or actually in a wave, but it's going straight. How can it get through the body? Other reflections and things going on. So there's a lot more we don't understand on that. So my wife is using one on her knee from a knee replacement, and she can tell the difference. And matter of fact, I can even tell her attitude and her outlook on life is better.
I
And,
feel happy.
kind of like a I feel happy thing.
Well, and I feel
She's-
like, especially when times like this, whenever it's gloomy, you don't have the sunlight, I feel like it's really important to
Yes.
do red light, during winter
Mhm.
time.
That's right. And maybe some other, are you familiar with any other light therapies or?
We use, there's tons of different frequencies for different targeted ailments, but definitely for mental. Just mental is a big deal. But pain, my wife uses it every night, and for overall pain and inflammation, it
Okay.
just does away with it.
Yeah.
What is she using?
We use a brand called Health Lights.
Is it a light or a tint?
They are LEDs against the skin. It's against the skin, and they run through think there are about 10 or 12 different frequencies that dial into it.
The more frequency.
So there's another thing that was just brought up, that as I was researching what lights I wanted to put in here, I've got a chiropractor friend right across the street, catty corner, and he's got a $50,000 red light bed that you go lay on. And the first time I went in, he said, "Come and check it out, Paul." So I go over there, and somebody was just getting up and leaving, and he said, "Let's go in, I'll show you my bed." And he's, that's when it all kind of hit me. He pulls out one of these things you clean your hands after you eat barbecue,
Hands, yeah.
a sanitizing
Sanitizer.
pad. And so he's on this whole gigantic bed, and I'm like, "Dude, get some Microban and spray that. Why are you doing this?" So it all came to me that, like you're talking about the pads that you've got, you're actually wrapping around. Well, a lot of people use red light therapy for skin issues. So you're going to be leaving residue behind.
Well, and these are personal.
Well, I know,
pads.
and that's what I'm
They're
saying
designed
is
for-
understand, because when you go to a chiropractor,
Yeah.
a lot of chiropractors are using these wrap around your torso pads, and I'm just not into that. I want that at 8 inches landing per centimeter square to where I don't have any transfer of anything.
Right.
And that's real important to me, and I'm not that I'm a germaphobe or anything, but I can't have a client come in and then the next client come in and end up with whatever they had. That's just not possible.
Right.
And I've always questioned the places that you go that use the wrap-on red light therapy, because somebody else had that on right before I got here. So something to consider.
Yeah, and so, and once again, this light panel that he's got, you can look at the lens, you can see that lens, and you kind of imagine, it's kind of like my glasses, but it focuses that, or spreads it.
Well, you can actually put your hand right in front of the lens and you'll see 5 different spots on your hand.
Okay.
Just, if you're messing with red light panels, look at it where you can see your hand and put it up close, and you'll see that it's a radiance is what they're calling that. So the radiance is what's going to land on different spots on your hand.
Okay, so, and then kind of a closing, and go ahead and submit your questions. We've got a few questions already, but submit your questions. And and I'm not sure, I think mine kicked off. Yes, mine kicked off, it looks like. So for some reason,
You going to restart it?
I don't know. I'm going to try that and see what happens. We'll restart. Okay, we're restarting for some reason. I got disconnected, maybe a bad connection. So anyway, submit your questions if you've got any. So it looks like somebody else has logged back in maybe. Concerns would be photosensitivity, like what we mentioned before. And actually, in the cancer area, we want to be cautious about applying it directly over a cancer cell or a tumor, because we just don't know. Okay? And it does help with energy production, and the theory is that it might provide even energy for a cancer cell. So applying it directly over a cancer cell or a tumor is not well studied yet, so I'm trying to be a little more cautious about that. But then there's other studies showing some definite benefits. So something but I have to just kind of throw that out as a disclaimer, so we want to be careful about that.
So I have
Something-
melanoma.
Melanoma, actually, there's a lot of research for melanoma, anti-cancer effect against melanoma. And like I said, that's more of a disclaimer is what I'm saying, because we don't fully understand and know, because this is a newer technology and newer information.
And if you're ever dealing with an open wound and red light therapy, what does red light therapy do? It enhances circulation. So like when we're using the photobiomodulation helmet on a stroke recovery, if it's a hemorrhagic stroke, nice plug.
Okay,
Go ahead,
yes,
Keith.
okay. And then eye safety, where those sunglass type things are made specifically for that. And be careful about overdoing it. And so like anything, we can get too much water. We can get too much sunshine. We can get maybe too much red light. So we don't want to overdo it. And then there's the quality issue. So we want to be sure and select good quality products, when we're doing that. So, okay, questions. A person with EGFR, non-small cell cancer, how would this help her? What type of device would you get if meds on different parts of her body, from her hip to her spine. So I do have a blog post that goes into more detail about specific cancers on that, and so it may help. I don't view it as like the number one thing. I'm going to be addressing that with other type techniques. So I'm also not allowed to make specific recommendations on social media, on those type of things. So it may be worth looking at, but I'd work with a practitioner that has experience with that also to evaluate other things that you're doing at the same time. I just joined, so red light, is it bad? I went to buy for hair growth, but I was scared. So yeah, red light, a lot of times those can help. It depends on how many LEDs are in that and the quality of the product, on that. As far as like being scared, I don't know if for using it for hair loss, I don't know of any particular concerns, on that.
I mean, what could happen? Just lose more, but already.
Yeah, just lose more hair. No, I wouldn't expect that to be an issue either. But following the directions of the manufacturer, and because once again, we can get too much of anything.
Yeah, people think more is
Yes.
better and more is not
I want
better.
to stress that. And so, people, have heart failure from drinking too much water. Okay? And so we have to be cautious about too much of anything. So somebody's got a particular brand of a red light, but wish to upgrade to a better one. So I'm not familiar with that brand, and so but you have to do your research. And once again, we at Hyperbaric.plus, he's got information about quality and how to help evaluate that.
Yeah, if you go to our resource page, go to hyperbaric.plus, go to the resource page and scroll down, you'll find a segment for red light therapy. And we're redoing our resource page. We're going to be adding a lot to it here in the very week or two.
Mm-hmm. Okay. So, and another person, thank you for this information. I've got another person, I've got breast cancer, now feel better, also follow you. Thank you for following, appreciate that. So,
Yeah, if you look up Fergus is the gentleman that does all the reviews.
how do you spell that?
Fergus.
Okay.
And if you do red light, Fergus, while you're on YouTube, you'll get a bazillion YouTubes, and he's got a good title for each of them, what he's covering, and very, very knowledgeable guy, and he's really done well to train people. That's where I got my knowledge, is just watching his videos. So anyway.
Yeah, and I want to make just another comment about cancer things, and so definitely this is a more along the lines of a preventative health type of a thing also. And so I mentioned not using it directly over a tumor because we just don't know for sure, but in a prevention type situation, according to theory, it probably would help keep cells from turning into a cancer cell, because it's going to help the mitochondria. It goes back to the metabolic theory about cancer. It's going to help cells to be healthier, improve circulation. They're not going to have as much of a chance to ferment and turn into a cancer type situation.
I just want to be happy.
Or be happy. Yes, let's just be happy. So are you going to sing a song for us?
No song singing. That's not allowed in here. Well, hey, it looks like does any other questions from our round table? All right. Okay. So are we good, Keith?
I think so, yes.
So anyway, thank you all for joining us for Red Light Therapy, and we'll be posting a bunch of things up on both Keith's website, or Keith's Instagram, and our Facebook. And all of our Facebooks migrate over to Rumble, so you can catch our stuff on Rumble. And we're going through cataloging and titling it right now. We haven't been very good. Keith actually brought our attention to that. Paul, I see all these videos. What are they? So anyway, we're trying to get that cataloged and a little more identification. So Keith at PrevailOverCancer.com and Paul at Hyperbaric Plus, come dive with us, and you don't get wet.
Yep, that's right.
They'll bring a snorkel. I mean, snorkels don't hurt. But anyway, come dive with us, and thanks for tuning in, and we'll see you next week.
Great, thank you.
Uh-huh.